What if we told you that the US should think about healthcare the way Rwanda does? Rwandans are the most likely in the world to say they trust their healthcare system. 97% of people have confidence in health institutions. In the US, it's about 76%. The UN calls it the Rwandan miracle. But is that true? Hey guys, it's Dina, and this is part 1 of our series, What the US Can Learn from Other Countries. Today, we're looking at what one of the poorest countries in the world can teach America about healthcare.
It is the hard work of a lot of Rwandans. Accept that it's a miracle, just give excuse to lazy politicians, lazy technicians to not try.
Rwanda had to pretty much build up everything after the 1994 Rwandan genocide. More than 800,000 people were killed in a Hutu power-led massacre.
The main challenge right after genocide against the Tutsis was putting everyone together.
National unity became the main goal of the Rwandan Patriotic Front, or the RPF. They were the Tutsi-led party that ended the genocide, came to power in 1994, and are still the ruling power today. The RPF was faced with a country that had no infrastructure. Hospitals were scarce. And for 83% of Rwandans living in villages dispersed in the country's hilly terrain, those hospitals were unreachable. So how did the RPF bridge the divisions that had destroyed so many lives? By bringing healthcare to rural areas. That was the beginning of Rwanda's highly successful community-based healthcare system. In 1999, the Ministry of Health picked 3 districts with a total population of 1 million people. There, it piloted its first 54 community-based health insurance plans through ongoing collaboration with local residents. And since 2008, it's been compulsory for Rwandans to have some sort of insurance. But right from the beginning, people knew that healthcare wouldn't be free.
It's very important in Rwanda to make the population contribute to development by paying some fees.
The richest pay about $7 a year for healthcare, but up to 25% of the population can't afford it, so they get medical care for free.
There is really this ideology that nothing should be free in post-genocide Rwanda, that free things destroy mentality, that it fosters a mentality of passivity and of dependence. And Rwanda wants to avoid that at any cost.
So how does this system work exactly? Over the past 2 decades, Rwanda has trained over 58,000 community health workers to serve the rural population. Each village has 4 workers who are elected by their community. But they're not there to perform medical procedures like deliver babies or administer vaccines. Those procedures still happen in health centers. Community health workers are there to prevent potential outbreaks from spreading and provide basic services families need. Think of it this way, they're kind of like a quick Google search for households, only a knock on the door away. This system is what led Rwanda to exceed the 2020 global HIV targets and educate 200,000 Rwandans about the Ebola epidemic in neighboring DRC.
ubu ngubu zimaze kuboneka nuko aho uri kugera akenshi mu baturage mu nama uri gusanga umuturage byibuze aziho nka 50% by'uburyo Ebola ifata.
It sounds impressive, right? 90% of Rwanda's 12 million people can access healthcare. Meanwhile, in rural America, there are only 30 specialists per 100,000 people, compared to 263 specialists per 100,000 urban residents. But some researchers are critical of Rwanda's top-down approach, saying it only works because the RPF has all the power in its hands.
I would describe the regime as quite authoritarian in the sense that actually political opposition to the Rwandan Patriotic Front is not obvious at all in the country.
While opposition parties may technically exist in Rwanda, rights groups say real opposition to the RPF is not tolerated. People who have dared to challenge President Kagame's rule have found themselves imprisoned or murdered. So it may be no surprise that the opposition in Rwanda is on the same page about compulsory healthcare.
In Rwanda, often you would see that other political parties will not necessarily challenge the idea of the RPF and will often actually repeat and amplify its message.
But despite a politically authoritarian environment, Rwanda's huge healthcare gains are undeniable. In fact, one community-based effort in Rwanda was so successful, the world wondered how Rwanda pulled it off. Rwanda's head-on fight against cervical cancer showed that women are at the heart of the country's thinking about health. In 2011, it became the first low-income country to introduce the vaccine against human papillomavirus, or HPV, to adolescent girls.
It is because we have already developed the trust with the population that we can go to the population, explain a disease they didn't know, about a portion of the body they didn't even know. Women knew they had an uterus, they didn't know they had a cervix.
Now, more than 93% of Rwandan 12-year-old girls have received the HPV vaccine against cervical cancer. The vaccine proved to be hugely effective. But in America, only 57% of 13 to 17-year-old girls have been vaccinated against HPV.
People have the right to have the truth and have the right to say no, but a no that is fully informed.
Women's health isn't just a one-off example. Women's empowerment has been at the heart of Rwanda's governance and education. Women make up 64% of the country's parliamentary seats. That's more than anywhere in the world. Rwanda's constitution actually says that women should hold at least 30% of posts in decision-making bodies. But neither parliament or those decision-making bodies have any real power to challenge the president or change the country's leadership. And there are limits to the empowerment of Rwanda's women. Abortion is only legal in the most extreme cases. 50 women were recently released from prison. Their crime? Having abortions. So despite Rwanda's tremendous achievements in healthcare, the country still has its own issues to work through.
Unfortunately, the kind of healthcare you are accessing is not that good. You will be often asked to pay for medication or even some surgical equipment yourself. So you have lots of hidden costs that are still remaining, partly because the state simply doesn't have money.
But what can the US take away in the meantime? First, the US could rethink how it invests in healthcare. Rwanda is a success story because the government convinced the private sector and NGOs to get on board with one health system.
If you are serious about health insurance, donor needs to put money in state budget rather than just, piecemeal activity.
Then there's prevention versus quick fixes. Tuberculosis, HIV, malaria, Ebola. Rwanda always had to be ahead of the game in preventative healthcare to protect its population from infectious diseases. That's why when COVID-19 arrived, Rwanda was ready.
Pandemics, epidemics may continue, but the best way to be prepared is to have a resilient and strong health system.
Finally, empowering marginalized communities. Even though now Rwanda's community-based healthcare looks more like a national health program, it was created by and for Rwandans. If America wants to make its people healthier, it needs to listen to marginalized communities most affected by inequality.
Advocacy is a major piece of giving people access to health. Advocacy for the finance of it, advocacy for the science of it, advocacy for the good practice of it, advocacy for protection, advocacy for participation.